Hello, Mrs. James. I'm here to talk to you about the new medication that we're prescribing for you, Atenolol. Atenolol is a beta blocker, and it's primarily used to treat conditions like high blood pressure, which is hypertension, which is what you have, and angina, which is pressure on your heart, cardiac arrhythmia, which is an irregular heartbeat, and lowers the risks of heart attacks, which we talked about that. It helps the heart to slow down and rest. It works by affecting the heart and the circulation. This means the way that the heart works and the way that your blood moves around in your body. So, there were two big words that we talked about. The first one is how the drug works in your body. So, Atenolol blocks beta-1 receptors in the heart. When this happens, it slows down the heart rate and reduces the force of each heartbeat, leading to lower blood pressure and reduced work for your heart. This helps prevent chest pain and lowers the risk of heart-related complications. The other big word we talked about is what the body does to the drug when it's finished. So the first part of that is absorption. When you swallow Atenolol, your stomach and your intestine absorb the medication or move it into the bloodstream. Next is distribution. Once it's in your bloodstream, Atenolol travels to the heart and blood vessels. This is where the real work happens. Next, metabolism. Unlike some medications that are broken down and filtered out through your liver, Atenolol is excreted through your kidneys. So it's mostly eliminated unchanged. It doesn't undergo any chemical changes in the body before the work is finished. Lastly, we have excretion. And the kidneys filter out Atenolol from the bloodstream, and it's removed from the body when you use the restroom. So, why this is a good choice for you? It has minimal side effects. So maybe sometimes it will cause some tiredness or dizziness or cold hands or feet, but rarely do people report side effects. And since you currently don't take any other cardiac or any other medications, I think this will be a really good fit for you. It's also long lasting, so you can take it one time a day at the same time every morning, and hopefully you'll remember, and it will work in your body to help those symptoms. Cardioselectivity. Atenolol primarily affects the heart, the beta-1 receptors, reducing the respiratory side effects compared with non-selective beta blockers. In other words, it doesn't do anything else. It just does what we want it to do. So there are a few populations that require special care and consideration, such as people who have asthma, people who have diabetes, and people with thyroid, disorders, because it sometimes will mask some of those symptoms like low blood sugar, hypoglycemia, and some thyroid concerns. But since you don't have any of those, we don't have to worry. So do you have any questions? Okay, I'll be sending this to your pharmacy, and if you have any questions, you call the office.